Dear listener, in this brief review we would like to introduce you to an original approach to the understanding and treatment of the condition called Buffalo Hump, which has been registered on the increase. But first we would like to introduce you to the developers and tell you about their new method of treatment. Realignment and reduction of Buffalo Hump by implementing manual therapy and aesthetic medicine. Manual aesthetic medicine method was proposed by father and son, Vladimir Sr. and Vladimir Jr. Tolkachev. Dr. Vladimir Tolkachev Sr. graduated from Medical Academy and has worked in the field of medicine for over 30 years. He is an author of a number of published academic papers and invented some of new approaches in treating various medical conditions. In 1987, he was awarded a PhD in medicine. While practicing traditional medicine, he became very interested in alternative medicine. He has 20 years of experience in complementary and alternative medicine. The last 10 years, he has devoted his time to investigating the mechanisms of the development of spine diseases, including Buffalo Hump condition, and worked on finding the treatment for them. Vladimir Tolkachev Jr. graduated from Medical University in 2009, specializing in orthopedics. Apart from his main job, he also spends a lot of time researching about the causes of spinal diseases and the cause of Buffalo Hump formation in particular. The Buffalo Hump condition is not only a medical but also a social problem, which is on the increase in recent years. It is not a direct threat to human life, but it can have a major adverse effect on the person's mental and emotional state. It lowers a person's self-esteem and degrades their quality of life. Buffalo Hump, or BH, is characterized by an excessive accumulation of dense adipose tissue on the back of the neck and interscapular region. As reported by the Daily Mail on the 20th of June 2015, Buffalo Hump liposuction procedures were on negligible interest in 2012. However, it went to a staggering 350% increase in 2013. Although it's still not widely available in the UK yet, and despite the fact that the cost is between £1,500 and £4,000, the demand for the BH removal is rising. As for today, and according to the well-known view of the nature of BH, the most common treatment for it is liposuction. Unfortunately, this approach doesn't always produce the desired effect. Apart from complications that usually accompany surgical procedures such as scars, uneven skin, or infectious complication, fat pad can re-emerge in the same place or in the places where accumulation of adipose tissue is usually not common, for example, on the face or around the joints. This causes an additional deep psychological trauma. The Tolkachev's observations show that accumulation of adipose tissue on the back of the neck and interscapular region is not the only cause of Buffalo Hump. In their opinion, there are two main components which should be taken into account: the change in spine configuration and formation of kyphosis, vertebral body's hump, and appearance of fat tissue. As a rule, surgical specialists do not recognize disfiguration factor as one of the causes of BH. The disposition of vertebrae in the neck and thoracic spine can cause headaches, unstable blood pressure, dizziness, limited neck mobility, pain, and numbness in the hands, and chronic fatigue. The aesthetic aspect of this problem is also very important. The presence of a hump in the open parts of the body is widely perceived as a handicap. While in society a person loses their confidence, becomes reclusive, and may fall into a state of depression. The practical experience shows that the treatment should begin with repositioning of the vertebrae in the problem area. The Tolkachevs developed a manual therapy technique which allows elimination of the intervertebral blocks, restoration of the physiological position of the vertebrae, improvement of condition in the surrounding tissues, and relaxation of the muscles in the neck and shoulders. After vertebrae repositioning in the problem area is completed, the thick fat pad becomes soft. The individuals with a slim figure usually have an elastic skin and fat pouch left, which can be removed by application of medicine cocktails. The cocktail components action causes gradual dissolution of fat cells. The disintegration products are removed through the excretory organs. The drugs which will return elasticity to the stretched skin and retone it should be administered at a later stage. Unlike a liposuction procedure, they do not cause any side effects. In order to regulate functions of the endocrine organs and the gastrointestinal tract, additional medications can be prescribed if necessary. Selection of such drugs is individualized. The duration of treatment depends on the amount of the accumulated fat tissue, degree of degenerative changes in the cervical-thoracic spine, and the presence of associated diseases. It usually takes up to 1.5 to 2 months. Preliminary studies demonstrate very good results, which mean that the Tolkachov's method is working. The Tolkachovs and their team appeal to everybody who would like to help Buffalo Hump research. They need a good clinical and instrumental base for their further in-depth studies. Also, the amount of $350,000 is needed for the most pressing needs: hiring medical personnel and volunteers, arranging premises, obtaining drugs and medical devices, setting up patients' examinations, including hormone level, thermography and MRI screening, scheduling treatment sessions and observations. The Buffalo Hump condition is not a verdict, but for some patients, it means returning confidence into their lives. Your every donation matters and will be highly appreciated. In the article below, you can read more about the Buffalo Hump conditions and the method of realignment and reduction of Buffalo Hump by implementing manual therapy and manual aesthetic medicine. We will stay in touch and give you full updates on the progress.